Hi, Dr. Dominic here at Elite Facial Plastic Surgery. Have you ever wondered what recovery is like from a facelift? I know this is a common topic, and that's why I'm bringing it up. I've had some patients who've asked me about it in consultation. And for the most part, the recovery from a facelift is something where you just basically got to take it easy. Usually on the night of the procedure, you're going to be wrapped up, essentially what I like to tell patients, like a human Q-tip. And the reason why is we do like to place drains, one behind each ear. So that way, if there's any excess numbing medicine, could be a little bit of blood that may drain out, that it will get caught in the dressing. Now, I know that may scare some people, but be reassured, normally you won't even see it because you have so much cotton and what's behind it that it tends to absorb it and normally doesn't even show. And then what happens is on the next day, you'll follow up with us. We'll take that outer dressing down and then normally remove the drains. In rare instances, we got to keep the drains in an extra day, but normally those come out. We put some antibiotic ointment over the sites, and then we normally put an elastic garment that velcros on top of the head and behind the head, and that helps to support and maintain some pressure on the skin as it's healing. We normally do like to wrap you up for another 24 hours, and then you normally take that wrap off the next day. And then from that point on, you're kind of just hanging out with this elastic garment on. Now, ladies, I know a lot of people don't like it because you can't wash your hair, but it'll be well worth it. Then what happens is you follow back up with us anywhere from 5 to 7 days later, at which point we'll remove that elastic garment, and then we start taking the sutures out that are present. Normally, those are present in front of the ear. They go around the ear, and they also go into the hairline. But the ones we take out are the 10 ones that are going to be right here in the front. You then follow back up with us a week after that. So for your 2-week visit follow-up, and then we take the stitches that are out behind the ear and in the hairline. And normally at that point in time, most patients get back to their normal routine of working out and doing strenuous activity. In some instances, patients will come back to see us on a 3rd week in case we want to follow some areas. But the other point to know about the 2-week time point is normally if you do have any bruising, it's usually done at that point. And then normally I'll see you a couple weeks after that, see how you're doing. And then sometimes about 6 to 8 weeks following that last visit. For the most part, I would say that 95% of my facelift patients say that it doesn't hurt. It's more soreness. I'd say 95% of my patients just take Motrin after the procedure as well. And if you have any other questions or are interested in facelift, check out our channel on YouTube. Have a great week.